Welcome to Western Perspective. I'm Madeline Lombardi. Hundreds of school bags were laid out in protest outside of Parliament House on Thursday to demonstrate a failing education system for the children, parents and teachers of WA. WAMN News spoke with Simone Wheatley-Hay from the National Parents Grassroots advocacy group Square Peg Round Hole WA about their involvement with the demonstration and what government officials should be doing for the betterment of our kids at school.
So I run a parent advocacy grassroots group in WA for inclusive education and accountability for children in education, do general advocacy for anyone who feels strongly about education or is coping with challenges and issues in accessing education. And we are working together to try and create systemic change so that we can get support. And what you're seeing behind us here is contributions from members of the community in response to a call out asking them to share their stories to the steps. So families traditionally and students, anyone with any kind of, I suppose, disagreement or dispute or challenge or issue hasn't been able to get support or collaboration or resolution from any aspect of education. Most of them have been unable to get anyone to even listen to what's going on. So we're trying to safely hold a space for those families to express what's happening to them, and also to do so in a way that, I suppose, makes the people who can make change aware of what's going on. So we've chosen the steps because A, all the decision makers are inside, and B, they're a symbol of inaccessibility. These are all families, children, students, community groups who are unable to access education. They're not all people with disabilities, they're not all neurodivergent people, but they're all people who for some reason or another have come across something that has blocked them from getting the education they deserve.
For sure, and I want to know, what are government structures, in particular in the education department, missing out when it comes to providing accurate and really well-given support to these children and families?
Sure. So the education department is currently run under what you would describe as a business model, as opposed to a service delivery model. We believe that it should be run like disability services or health, where the primary focus is on the community that's being served. We don't feel like education is being run like that. I mean, the Minister and the Director General don't have teaching experience themselves. We feel like those who should be deciding priorities, deciding whether it's working, deciding where money should go, should be consulting people with disabilities, consulting teachers, principals, not just unions, other commercial stakeholders, corporate services. We believe that people with disabilities should be heavily involved in co-design. They're the people with lived experience who can explain what works. And we also believe that there needs to be some kind of independent oversight and accountability, because at the moment everything is done internally within DOE. And even with the best of intentions, there's going to be a degree of collusion. It's impossible to be impartial from within.
So at the moment, what you're saying is, I think we're relying on structures that are implemented in a business model, for example, or using a structure to fulfill these roles that actually don't go to the source independently. They don't go to see what's happening with the students or families involved. Or
community members or people with lived experience. The state disability strategy is a perfect example of how it should be done. It was co-designed and created by a working group of people with lived experience of disabilities. And they're not the ones rolling it out, and they're not the politicians responsible for implementing it, but the fundamental premise, value, structure, priorities has come from that community. And we believe the same should be done in education. We also believe that there needs to be independent monitoring, transparency, data collection, accountability, because at the moment money is being wasted, and massive amounts of money is being wasted. Programs and services are being put in place that aren't achieving their outcomes, that in a lot of cases are actually making things worse, and it's costing taxpayers millions. It's not smart spending, and it's not what the people of WA deserve.
In a country like Australia, we shouldn't be having to fight for these issues, as you're saying. Children should have that right to be, feel comfortable and safe when they go to school in that sense.
And it's their human rights. Australia has committed to that when they signed the UN documents, the right of the child, the Convention on the Rights of Persons with Disabilities. They've promised to do these things. They've committed to do these things freely. And now it's time for them to hold themselves accountable and start doing them.
Finally, we've had a huge chat about kind of the issues that need to be fixed in that sense. What are you hoping that government structures realise from this demonstration of protest, and what are you hoping they do to change?
The very first step would be admitting that there's an issue. At the moment, it feels like there's a blanket denial and refusal to acknowledge that things are not 100% okay. As far as they seem to feel, things are fine, the sky's sunny. Starting to acknowledge that, okay, improvements need to be made, these things are real. We don't need to be defensive, we need to be collaborative. And then to start collecting data, monitoring, publishing data like all the other states do, and WA doesn't. And then to start looking at things like universal design for learning that are great value for money, have positive outcomes, and are inclusive and aligned with human rights conventions. It's not hard.
And now here is AMA WA spokesman Dr. Andrew Miller with his weekly COVID-19 update and medical commentary.
Hi, thanks for your time. I support nurses and I want to see them get a fair deal. And the fair deal is not the current government wages policy, which everyone points at like it's something that's been decreed from on high. It's not. It's just a policy of the government to say they're not going to pay more than 3% at a time when inflation is 7%. Nurses realise they're going backwards. Their workplace is getting more difficult. The acuity of their patients is going up constantly. The system is in crisis and people are being expected to do more with less all of the time. And what nurses are most worried about is that people leave and that there's no incentive for others to come in or others to return when they're able to, in order to contribute to the system. And that then leaves patients suffering for the long term, not just for one day during an inconvenient strike, but for years and years, and losing the opportunity to have problems fixed when they should be. So we need to take care of our nurses, and hopefully the government will come to its senses and realise that they're the ones that actually made the wages policy. They're the ones that can change the wages policy. Giving them 5% and 3% instead of 3% is not going to break the royalties bank anytime soon. We see another cruise ship coming in. It's a bit like deja vu, isn't it? We said this was going to happen when the cruises started up again, and although this load of patients is probably not going to make a big dent on Western Australia, you really got to wonder, what does this say about the psyche of our country? That have we got the message yet that we need to breathe clean air? Have we got the message yet that we need to wear masks in indoor crowded locations? Have we got the message that it's not 2019 anymore and that we have to take this virus seriously? There's a lot of evidence now that even if you're vaccinated, repeated infection with the SARS-2 virus is bad for your long-term health. Could well be worse than smoking for your long-term health to get this infection a couple of times a year, because we know that it's causing damage to the vascular system throughout people's bodies. And that damage, like with smoking, may be subtle initially. It may be that young people don't even notice it. But over time, you're building up a debt that one day your health is going to have to repay. That seems to be the message that we're getting from all of the research, and not to mention the fact that there is still the issue of long COVID, which can cause symptoms many months after infection, and also the occasional rare cases of people who are previously quite healthy ending up in the ICU and very unwell indeed in a life-changing way. So the simple things that we can do: stay up to date with our boosters, get our kids under 5 vaccinated, which the government haven't agreed to do yet for reasons which are unclear, and get on with breathing clean air whenever you possibly can. Thanks very much for your time.
That's Dr. Andrew Miller, and now a brief weather update. Good news is on its way as the weather is warming up. 30 degrees on Monday, a record high of 36 on Tuesday, with an overnight temperature of 19 degrees, 33 on Wednesday, 25 on Thursday and 28 on Friday, before it drops to 14 degrees at night. It'll be mostly sunny throughout the week, and that's Western Perspective this week. We'll be back again next Sunday. Until then, Ivan and Melly, it's back to you.
36 degrees is a real scorcher. Slip, slop, slap will be a must. Thanks, Maddie. In the meantime, don't forget to subscribe to the WMN Extra News Club so we can continue our work in the community. Full details on wmnnews.com.au/news/extra.
And that's our news for tonight. Let's find out more about the Victorian election results. National news relays from Melbourne. Leo Puglisi, 6 News takes over now.